Welcome. My name is Ruth Ann Barnard. I work in the Office of Long-Term Living. I am the PASRR coordinator for Pennsylvania. This training is for Aging Well, or the AAA, and the Nursing Facility Field Operations representatives. The AAA is referencing the Area Agency on Aging for this training. The PASRR Level 2 evaluation is meant to be done in the presence of the individual who is being evaluated. This may be done face-to-face, via a phone call, or a teleconference, or even a virtual call with the individual and/or personal representative. You will be expected to send any and all supporting documentation that you will be using to support your responses to the Department of Human Services Program Office to help them make their final determination. These are the objectives for this training: sequence of the PASRR process. What does the program office criteria mean? Who does the PASRR Level 2? Role of the program office, review of the PASRR Level 2 evaluation form, program office order for packets, important websites, and who to call for questions. Handouts for this training can be found on the Pennsylvania PASRR website, where this training has been posted. The PASRR Level 1 is completed by the nursing facility, the hospital, or Aging Well, or the AAA, no later than the day of admission. Family members may assist in this process, but nursing facilities are ultimately responsible to make sure the form is filled out correctly upon admission to their nursing facility. If the individual has a mental illness, intellectual or developmental disability, or other related condition diagnosis identified on the PASRR Level 1 and meets the criteria for the program office, the PASRR Level 2 evaluation must be completed before entering the nursing facility. Also, a letter of determination must be issued from the program office prior to admission to the nursing facility. Some PASRR reminders: the PASRR Level 1 must be completed prior to admission. Only one PASRR on the clinical record per admission, unless a new PASRR Level 1 generated a program office letter. The PASRR Level 2 date cannot be before the PASRR Level 1 date. A new PASRR Level 1 is not completed when changes are needed to be made to the form. Instead, update the original PASRR Level 1 to reflect the change or changes that need to be made. And how do you update the PASRR Level 1? Update with diagnosis, the psych stay, or additional information that affects the PASRR directly on the original PASRR Level 1 form. If a change in criteria results in a PASRR Level 2 needing to be done, page 7 of the PASRR Level 1 form will need to be updated to reflect that a PASRR Level 2 now needs to be completed. Any updates made are to be initialed and dated. Aging Well, or the AAA, if you are called by the hospital to do a PASRR Level 2 and the hospital has already filled out the PASRR Level 1, use the PASRR Level 1 that the hospital filled out. Do not do another PASRR Level 1. The hospital most likely will have sent the copy that they did to the nursing facility. And then if you do one, there will be 2 PASRR level 1s. When program office criteria is met before admission, PASRR level 2 evaluation must be completed by the Aging Well or the AAA. After the PASRR level 2 is done, a program office letter of determination must be issued before the admission to the nursing facility. Positive PASRR level 1s after admission. If there has been a change for a resident that affects PASRR, what is that process? A MA 408 is sent to the field operations office to indicate that there has been a change. The PASRR level 2 evaluation will be completed by either the county Aging Well or AAA office or nursing facility field operations. Field operations will do the PASRR level 2 evaluations if the individual is already in the nursing facility, and only if the individual does not need to be assessed for medical assistance. If the individual needs assessed for medical assistance, then Aging Well or AAA will do the PASRR level 2 after an individual has been admitted. After the PASRR level 2 is completed, a program office letter of determination is issued by the program office. Now we will start the pre-admission screening resident review level 2 form. At the top of the form, we want to know the date of assessment, the individual's name, social security number, birth date, county of origin, whether the individual is enrolled in or applying for medical assistance, and the medical assistance number if there is one. I want to caution you that this date must be the same date or dated after the PASRR level 1 form. Recently, we have been seeing some forms that are dated before the PASRR level 1 date. Not sure how that is possible because the PASRR level 1 form is what triggers the PASRR level 2 evaluation to be completed. If you do not have the PASRR level 1 in hand when you are doing this evaluation, there is a problem. Stop and go and find the PASRR level 1 form that was done. Don't wait to see if it shows up and do not fill out another one. By doing another form, you will be out of compliance because the date of the PASRR level 1 will be after the date of the PASRR level 2. Also, one more thing that needs to be mentioned here. By federal regulation, the PASRR level 1 form must be on the residence chart in the nursing facility. If you receive information from a nursing facility for the packet to send to the program office for your review and notice a change that needs to be made to the PASRR level 1 form, make sure you update the PASRR level 1 form. That updated PASRR level 1 must be sent back to the nursing facility so that they have the updated version of the PASRR level 1. This updated PASRR level 1 that you made the updates or changes to must be the one PASRR level 1 on that individual's chart in the nursing facility. And the copy of the PASRR Level 1 that you send to the program office must be the same one that the nursing facility has on the resident's chart. At all places, your records, the packet that you sent to the program office, and the resident's chart must all have the same version of the PASRR Level 1 with your updates on them. Please make sure the nursing facility is aware of the update and give the nursing facility the copy you updated, and ask that they destroy the one prior to your updated version. Section 2 is the medical documentation section. At Section 2A, we want to know the current diagnosis or diagnoses related to the individual's mental illness, intellectual disability or developmental disability, or other related condition that the individual currently has, and the approximate date of onset for these diagnoses. If there is not enough room for all diagnoses, attach another page for the rest of the diagnoses at the back of this form. At Section 2B, we want to know if the individual is currently displaying any of the symptoms or behaviors to the degree that he or she may injure himself or herself or endanger other nursing facility residents without constant supervision by healthcare personnel. The behaviors or symptoms listed are assaultive and/or self-abusive, aggressive, disruptive, inappropriate, depression, anxiety, feelings of loneliness or worthlessness. This would be either to themselves or others. We want you to explain any of these behaviors that you mark with a yes. Please review the medical chart and/or notes or another documentation that you would have either from the doctor's office or hospital. At Section 2C, number 1, we want to know what current medications the individual is taking and the diagnosis that the medication is prescribed for. Sometimes medications are used for two very different diagnoses, such as Megace. It can be prescribed as a chemotherapeutic for breast cancer, and it can also be prescribed for individuals that need to gain weight as an appetite stimulant. Also, some psychotropic medications are often prescribed for dementia behaviors and not for a mental health diagnosis. Diagnoses for the medication should only be taken from the physician's order or the medication administration record. At number 2, we want to know if the individual has any allergies or adverse reactions to the medications you have listed above, or any allergies to any medications not listed above. Neurological. Section 2D, you need to check all the neurological symptoms that apply to the individual. Right-sided weakness, left-sided weakness, right-sided paralysis, left-sided paralysis, unsteady gait, shuffling gait, excessively slow movements, use of assistive devices, weakness of arms, legs, hands, and feet. Is there any alteration in response to pain, touch, or temperature? any uncontrolled movements or falls. At section 2E, we want to know what the individual can do. We want to know about activities of daily living, or ADLs. Can the individual take care of themselves, eat, dress, bathe, and groom themselves? Can the individuals do their own individual independent ADLs? Can the individual take their own medications, go to a doctor if they need to, and are able to keep appointments when scheduled? Can they manage their own money? At number 3, we want to know, can they follow instructions? Do they respond when spoken to and respond appropriately? Can they communicate their needs, pain, or discomfort? We want you to elaborate each of your no responses to explain. At section 2F, it asks about the individual support system and whether they have any socialization with others. Does the individual respond when people talk to them? How about initiating contact with others? Do they recognize that they do not feel good and need to see the doctor? We want to know the medical and social or family supports the individual has. And then what activities does the individual do that shows that they are socializing with others? Do they go on a trip with their family, go to church, or go bowling every week? For review type, we want to know for which program office you are doing this evaluation. It may be for just a mental health or an intellectual developmental disability, or it may be for 2 or 3 program offices. What is checked in this section will determine what sections of this form are filled out, in addition to the particular program office section or sections. All evaluations must have sections 7 through 11 filled out. Section 4 is the mental health section of the form. We want to know what serious mental illness diagnosis the individual has. And at number 2 in section 4A, we want to know the functional limitations in the last 3 to 6 months in the 3 areas of functioning: interpersonal functioning, concentration, persistence and pace, and adaptation to change. Please describe why you checked yes. Does the individual have difficulty in adapting to change with the family, environment, or perhaps their own medical situation? Are they not able to complete simple tasks like they used to do? At 4A, number 3, we want to know about the individual's treatment history and if the individual experienced at least one of the items in A through E at least once in the past 2 years. Inpatient stay. Episode of significant disruption where supportive services were required due to the individual's mental illness. Suicide ideation or attempted suicide. Electroconvulsive therapy or ECT for the mental health condition, or a mental health intensive case manager. All of these must be due to the mental health diagnosis. 4B contains a list of supporting information that needs to be sent to the mental health program office for the PASRR Level 2 review to make their final determination. The whole review process, according to federal regulations, should only take 7 to 9 days. This means from the date of the PASRR Level 1 form to the date of the letter of final determination. This whole process is to take only 7 to 9 days. If you cannot get all the information listed in number 1, get what you can and send it to the program office. The packet that you send may have enough information to make a determination, or it may not have enough information. If it does not contain sufficient information, the program office will generate a letter saying that they need more information to make a determination. And that is okay because you have met the federal regulation prior. You have met the federal regulation of identifying the individual who may meet criteria for the program office. Aging Well or the AAA, when you receive the requested information, send it to the program office so that they can make the final determination and issue a letter so that the individual knows if they can be admitted to the nursing facility or not. If this process is being done post-admission, the entity doing the PASRR Level 2 would forward the documentation to the program office for their review. We continue to use the St. Louis University Mental Status Exam, the SLUMS, and it is a requirement for the PASRR Level 2 form. The SLUMS is a tool that helps to detect mild cognitive impairment and dementia. The SLUMS exam can be found on the last page of this form if you do not have it elsewhere. For the PASRR Level 2, we need to know the individual's score. There is a checkbox on this form in case they refuse the test. At number 3 in section 4B, we want to know, in your judgment, what would you say is an estimated level of intelligence for that individual? There is not a right or wrong answer for this question. Section 5 is the intellectual disability or developmental disability section. In section 5A, we need to know if there is documentation to indicate a diagnosis of intellectual or developmental disability. Supporting documentation may be an IQ and adaptive testing, preferably before the age of 18. The age of 18 is the age that the federal government uses as a developmental age for intellectual or developmental disability. And we need to follow this guideline. Other documentation can be psychological reports, psychiatric reports, school reports, summaries from the county intellectual disability or developmental disability program or intellectual disability developmental disability agency, and other related professional reports can be used. List what documentation you have on the line on this form. The program office needs to know if the documentation that you have provides evidence of sub-average intellectual functioning with an IQ of approximately 70 or below on a standardized intelligence test. Was the onset of the intellectual disability prior to the age of 18, and whether there are deficits in adaptive behavior or functioning on formal assessments. On this form, we need you to indicate the level of intellectual or developmental disability. And this score is based on the IQ test. (5B) is supporting information for intellectual or developmental disability. At number 1, does the individual have a supports coordinator? If the individual has one, please list the supports coordinator's name and agency. At number 2, list the information that the Intellectual Disability or Developmental Disability Program Office needs to make a determination. And all this information would be included in your packet of information that you send to the program office. We ask that you check the boxes of what you include in your packet here. Section 6 is other related conditions. Other related conditions include physical, sensory, neurological disabilities which manifested before the age of 22 and are likely to continue indefinitely and result in substantial functional limitations in 3 or more of the following areas of major activity. Those are self-care, receptive and expressive language, learning, mobility, self-direction, and capacity for independent living. Section 6A, we ask for the documentation of the diagnosis. At number 1, is there documentation to substantiate the individual meets the criteria for another related condition? Documentation is to include a psychological evaluation, physician's note which indicates the diagnosis, and 3 functional limitations that occurred prior to the age of 22. A statement from the individual or family may suffice for this as well. Please list the documentation on the line. At number 2, we ask if the documentation provides evidence of a physical, sensory, or neurological disability, which is considered another related condition. List the diagnosis on the line provided. Did the condition manifest before the age of 22, and is it going to continue forever? Section 6B, supporting documentation. Number 1, indicate the areas where the individual has substantial functional limitation that manifested prior to the age of 22. Persons can have another related condition and may be intellectually intact. For example, persons with cerebral palsy. Generally, these persons will attend school, work, perhaps marry, and live independently. These persons would not meet the criteria for this program office, as they would not meet the functional limitations prior to the age of 22. Number 2 is a list of items the program office needs submitted to make a determination. You are to check off each item that you have included in your packet. Section 7 is the findings and recommendations section. At section 7A, number 1, does the individual have a suspected or confirmed serious mental illness, intellectual or developmental disability, or other related condition which meets the criteria for further review by the respective program office? Number 2, does the individual currently receive services in the community for the condition he or she has? Yes or no? You need to list what services are being received by the individual. And number 3, is the individual seeking nursing facility placement right now? If not seeking nursing facility placement, what placement is the individual seeking? And if nursing facility placement is being sought, is there a nursing facility that has been decided upon? The last question in this section asks if the individual needs health rehabilitative services such as physical therapy, occupational therapy, speech therapy, or restorative nursing for his or her mental illness, intellectual or developmental disability, or other related condition. If so, list the type of service that would be required in your opinion. Section 7B, Desire for Specialized Services. This is the section where you explain to the individual what specialized services are for the program office and find out if the individual would like to receive the services in the nursing facility if you were to recommend the services to the program office. The services are the services that could be provided to the individual in the nursing facility. Some of these individuals may have been receiving some services in the community and may benefit if they would continue to receive them in the nursing facility. You would check the applicable program office to indicate that the individual and or his or her representative have been informed of the specialized services that are available for that program office. These are the specialized services that are available for the mental health. Partial psychiatric hospitalization, psychiatric outpatient clinic, mobile mental health treatment, crisis intervention services, targeted mental health case management, such as intensive case management and resource coordination, peer support services, and outpatient drug and alcohol services, including methadone maintenance clinic. For a medical assistance individual that has a community health choices managed care organization, there is actually a behavioral health managed care organization that would provide some of these services for an individual in the nursing facility. These are the specialized services that are available for intellectual disability or developmental disability, assistive technology, behavioral support, communication specialist, companion services, housing transition and tenancy sustaining services, in-home and community support, supports coordination, support for the medical environment, and transportation. I want to mention here that supports coordination is for the intellectual or developmental disability diagnosis. This is a specialized service and is not the same as service coordination that the community health choices managed care organizations would provide. And these are the specialized services that are available for the other related condition program office. Service coordination, advocacy services, peer counseling support groups, training, community integration activities, equipment or assessments, and transportation. I want to mention here as well that the service coordination is for the other related condition diagnosis. This is a specialized service and is not the same as a service coordination that the Community Health Choices Managed Care Organization would provide. Continuing with Section 7B, Desire for Specialized Services. Number 3, based on your evaluation, will the specialized services be needed if the individual will be served in a nursing facility? And if so, what services do you, as the assessor, recommend to them? Number 4, if the individual will be served in a nursing facility, Would he or she need any services of lesser intensity than the previously mentioned specialized services? If so, what services do you as the assessor recommend? Number 5, does the individual understand what you have said about specialized services? And number 6, if recommended, does the individual want to receive the specialized services? Remember that specialized services are services that go above and beyond what the nursing facility provides on a daily basis to care for that resident. Section 8, Notice of Referral for Final Determination. This is where you now explain to the individual, family, legal representative, and/or significant other that the individual may not always need nursing facility services and should be placed in the most appropriate setting for their needs. And that this evaluation is a way of assessing if the nursing facility is actually where the individual needs to be. You read the section to the individual based on which program office you are referring them to let the individual know that they are someone that needs a further evaluation by the program office, and that what you have filled out on this form and the information you have collected will be forwarded to the program office so that they can determine the need and appropriateness for nursing facility care and specialized services. Section 9, name and contact information for the assessor who is completing this form. The assessor needs to sign the form here and add their information, agency, email address, etc. According to the federal regulation, a copy of this evaluation can be given to the individual if they would request it. And we have a question for that here on this page. In section 10, this is the list of all information you must include for each of the program office packets. Your check mark indicates that the information has been included in your packet that you will be sending to the program office. The MA51 that you include with your packet of information must also be current. And section 11 is the notification sheet. This is where all the contact information goes. This is very important for the program office to have this filled out entirely in case the program office has questions. Make sure that you also have physician information that is required on this page. The address of the hospital would not be listed on the form for the individual's address unless the individual is homeless and has no power of attorney or case manager. If the individual is in the hospital, on the notification sheet, we need the name of the social worker or case manager at the hospital and the fax number for that person. This is very important, especially for the mental health program office, as the letters of determination are faxed to the hospital as soon as they are completed. We have a contact email on this form for the contact person, as correspondences go by email now. There is a little reminder note at the bottom of this page to include those fax numbers. And this is the last page, the St. Louis University Mental Status Examination Tool, or the SLUMS for short. For aging well, or the triple A's, the SLUMS or any tool or any other tools are not a requirement for the functional eligibility determination, or the FED, to determine nursing facility eligibility. But the SLUMS is required when you are doing the PASRR Level 2 evaluation. If you are not doing this evaluation face-to-face, the nursing facility social worker or speech therapist may complete this for you. You have gathered your information and have your Level 1, PASRR Level 1 and PASRR Level 2 forms completed. What do you do next? What is the next step? All of your information is now sent to the appropriate program office. And where do you send it first? This slide shows how the program offices get their packets of information from you. If you have a mental health program office packet, it goes to the Department of Human Services Office for Mental Health and Substance Abuse Services office. If you have an intellectual or developmental disability program office packet, it goes to the Department of Human Services Office of Developmental Disabilities Program Office. If you have another related condition program office packet, it goes to the Department of Human Services Long-Term Living Program Office of Long-Term Living. If you have multiple program offices that need to review the packet, you are only to send to the first program office and not to all of the program offices. The first program office is to send the packet to the next program office to review after they have reviewed it. You would send in the priority listed on this slide. Mental health is the first program office, intellectual or developmental disability, and then other related conditions. If you are a field operations representative, make sure your nursing facility transmittal form indicates the program office or offices the packet is to be sent to. On this page, we have important websites. The Pennsylvania PASRR process website, the out-of-state process for PASRR, the long-term care for provider website. This is where you would find case mix information, rate information, the resident data reporting manual, and many more items. And last, the website for medical assistance forms. This is the website you would go to download and print the PASRR Level 1 and PASRR Level 2 forms. The admission notice, the MA 401 packet, and the nursing facility PASRR positive reporting information form, the MA 408, is also available at this site. And this is what is on the PASRR website on the right-hand side of the page. The PASRR forms and documents. Under the PASRR forms and documents, the PASRR Level 1 and PASRR Level 2, and the MA 408 forms. On the right-hand side of the page further down, we have the PASRR bulletins for the PASRR Level 1, PASRR Level 2, and the MA 408. Here are the additional PASRR resources on the right-hand side of the page, the PASRR clarification and frequently asked questions document, handouts for trainings. PASRR training webinars will be posted here. PASRR contact information for field operations and the program offices, and the state PASRR coordinator's phone number. As these resources change routinely, please use the PASRR website main page on slide 35, the first bullet, for the updated links for the resources on this slide. I want to thank you for listening to today's presentation. Remember, PASRR is about honoring a person's choice. A nursing facility may not be their choice, and we should be mindful of that. If you have questions regarding what you have heard, please do not hesitate to reach out to me regarding your questions.